Health and Wellness Minister Dr Christopher Tufton says management of the COVID-19 pandemic has presented many lessons to the island's public health system. He shared the same as he made his sectoral contribution in the House of Representatives on Wednesday. Simone Absalom-Gayle reports.
The health minister says public health authorities had a crisis management plan that provided the framework for managing the COVID-19 pandemic long before the first case of COVID-19 came to Jamaica.
Our surveillance capacity worked well and showed that whether it is a dengue outbreak or a global pandemic, the likes of COVID-19, we have the capacity to monitor and conclude on the issues to respond effectively. Surveillance, Madam Speaker, is the brain and nervous system of Jamaica's response to public health threat of the COVID-19 pandemic. It provides crucial ongoing data from a variety of sources such as hospitals, communities, and laboratories. Using our effective and well-trained team on the ground, we tracked the numbers, analyzed the trends, and presented the data in a structured, understandable way for decision-making in response to the pandemic.
He spoke highly of the management of the pandemic, noting the case fatality rate related to COVID-19 is currently 1.8%, which is less than the global average of 2.2%. He pointed to the hard-working public health doctors and nurses, support staff and administrators who stood up to the task in managing the pandemic while keeping up daily health services.
Our hospitals and their management teams of CEOs and SMOs, directors of nursing, supported by the Ministry of Health and agencies such as the National Health Fund, demonstrated that we can respond to an exponential threat. Between January 2020, Madam Speaker, and March 2020, when our first case was discovered, those very members in the public health system, the hospital management, had put in place 163 COVID beds by the March 23rd. March 10th was the first case. And currently, we have over 723 COVID designated beds, including our field hospitals that are prepared to deal with persons who need that kind of care.
Minister Tufton says taking the lessons learned and building back stronger is the mantra for his team, and it's now tied to the plans for renewal and rebuilding of public health in keeping with Vision 2030. He recalled the government's commitment to spend up to $31 billion to build out our public health infrastructure over the next 5 years.
I'm pleased to report, Madam Speaker, that under this program, which is the Health System Strengthening Program, 11 of 13 facilities have been designed and are being reviewed now for final approval to move to the next stage for building out. These include, Madam Speaker, the Spanish Town Hospital, the St. Anne's Bay Hospital, Maypen Hospital, and in addition, we have completed external upgrade designs for the University Hospital of the West Indies and also the Cornwall Regional and Western Children and Adolescent Hospital in Montego Bay, though that build-out will continue over time.
He highlighted work being done in several hospitals, including the Spanish Town Hospital, a Type B facility, now set to benefit from a $2.3 billion upgrade.
With this upgrade, Madam Speaker, new services are going to be added to the Spanish Town Hospital, including urology, oncology, cardiology, gastroenterology, ophthalmology, and psychiatry will all now be offered in the new-look Spanish Town Hospital, Madam Speaker.
Dr. Tufton says it's time to share and reinforce the good things from the COVID-19 experience. Time to be hopeful and renew and build back stronger. For the news on PBCJ, I'm Simone Absalom-Gayle.